Requires physiotherapy help, but I'm surprised that why this opportunity was not offered to me before. Well, I've been asked by the physiotherapy speak on the role of physiotherapy. As we all know that total joint replacement has become a major surgical procedure and a very common one. And of all the joints which undergo replacement, probably knee has become the largest when it comes to the numbers. Well, total knee replacement is a very common orthopedic procedure and has over the years become the most common orthopedic surgery done throughout the world. And it is a simple procedure which involves the replacement of the articular surfaces of the respective joint. That is, in case of a knee, the distal femur and the proximal tibial surface is replaced by artificial surface. It might be metallic or polyethylene to provide a frictionless, painless, smooth movement of the joint, so that patient can have a pain-free active life. Now, why TKR? So, TKR is such a common procedure, and it's helped a lot of people to improve the quality of life, provide them independence, and that is what is required once osteoarthritis or degenerative arthritis secondary to other regions. We all know that earlier stages of osteoarthritis is managed with the help of medication and physiotherapy. But when the joint damage exceeds its medication and when these procedures tend to fail, this is what we end up with. And our patients need the replacement once all the other methods tend to fail and their patient is still in pain and discomfort. Well, why about TKR? Again, as I told you, knee replacements have become one of the most common orthopedic surgeries done throughout the world. If you look at the Western world, if you talk about America, there's about 8 lakhs of knee replacements done per year, and the numbers are rising. If you look at the numbers of the UK, it's about 1 lakh knee replacements per year for the small countries. So the numbers are huge, and they are still growing. When you look at our country, the numbers standing at now are about 2 lakh knee replacements per year, and this number is expected to go 10 times in coming 10 years. So immediately, you might be seeing about say 8 to 10 lakhs of knee replacements being done per year in coming 5 to 6 years. That's a huge number of surgeries being done. And why am I talking to you is because it's not just our role. The patient comes to us, gets admitted, gets through the surgery, and is with us for 3 to 4 days. But it's the physiotherapist or you people who take care of them post-surgery for a few months and do spend more time with them, helping them to recover from the surgical procedures and getting back to life. So, more than 10 lakh knees year in coming future, and with months of physiotherapy requirement, I think so they will be not dependent upon you, and they will need you for a much longer period and for much longer time to regain health than what we would be able to get that time. So now, I'll just restrict myself to the physiotherapy part of the knee replacement and leave the orthopedic part apart. If any questions regarding the orthopedic procedure, the surgical procedure, the implants or any other whereabouts of the total knee replacement, you are most welcome to approach to me and contact me and clear your doubt. I'll just talk about basics which we as a surgeon want our physiotherapist colleagues to help us out when it comes to achieving a certain amount of goals in the patients. Well, the physiotherapist is an integral part of the team of healthcare professionals who help people receiving a total knee replacement to get back to their daily activities effectively, painlessly, and as best as possible. Okay, so the physiotherapist is a very important part of the team, and from pre-op stage to well beyond the surgical time, a physiotherapist plays a role, maybe much more than what a surgeon or a nursing team provides them. The physiotherapist can help a patient prepare for the surgery and recover from surgery. And they usually require an individualized program depending upon each patient's requirement and the disease process to get the patient again back to moving and as best as possible. Now, when we talk about post-treatment, post-knee replacement, how can a physiotherapist help and what is expected from a physiotherapist to augment the surgeon's abilities and commitments? Well, a physiotherapist would help us to ease the pain and reduce the inflammation in the early post-op period when patient is undergoing through recovery from the surgical wound, maintaining circulation by providing mobility, restoring joint strength and range of motion, strengthening and supporting the muscles, eliminating joint pain and stiffness, improving balance, regaining normal gait pattern. That is what is most important role of physiotherapist when it comes to recovering from joint replacements. And most of all is returning the patient back to normal activities and function as they were when they had normal surgery. Well, when we start off with a patient who is undergoing, who is planning or who is scheduled to undergo a joint replacement surgery, preparation is probably the most important thing, and the preparation starts before surgery. So the post-surgical rehabilitation exercises can be taught and the patient can be trained pre-operative. That's a good time when patient is not having pain, it is not undergoing through the discomforts of the surgery, the medications and the medical illnesses which might be associated. So pre-surgery is a time when a patient can be taught about the post-surgical rehabilitation program. And this helps in patient in understanding and following the protocols post-surgery, and it becomes an easier way out. Well, physiotherapy as per se may start within the day of surgery. In the evening rounds, we tend to assess the patient and patient score of pain. If patient is comfortable, we advise our physiotherapist to go ahead and start off the physiotherapy protocols like static quadriceps, sitting and general exercises from the day of surgery. If the patient is having a pain, we can be rescheduled and maybe postponed for a day or two. Again, there are certain amount of protocols which are laid down by each surgeon or each arthroplasty team, and what is important is to personalize the whole protocol for each patient. Usually, I prefer, and most of the joint replacement teams, they prefer the physiotherapist to be there from the pre-surgical time to the post-surgical, to be part of the rounds daily so that they can assess and define the exercise goals which we have for each patient so that we can be better constituted and be a part of this. Yes. Before we begin the physiotherapy protocol, I would expect my physiotherapist to have a subjective assessment of the physiotherapy, because each patient is an individual and we need to prioritize and personalize the protocols which we are substitute for a patient. So various
इसको लेके अपने पास ही रख लीजिए, कोई इधर उधर कर
so that physiotherapy can be individualized for each patient. The objective assessment is also very important, not only from the history, but also we have to be at every stage, assess the patient and understand the requirements of each patient, depending upon what findings and what examination protocols are laid down. Well, if you talk about the post-surgery, this is a generalized, just a viewpoint for a maybe for a normal simple need, which can be customized as per recording. But if you take at first 2 to 3 weeks of post-surgery period, that would focus on mainly making the patient comfortable, giving them relief from pain and inflammation, and setting in the movement of the joint. So, patient education regarding the pain, achieve basic knee flexion movements so that patient can actively do their daily activities, reduce pain, allow them to weight bearing, and start giving them independence of mobility so that they are not dependent once they go back home. Well, as I already said, the initial goal in the first 2 weeks is mainly to relieve them of pain and set in the mode for the motion and mobility for the joint. Well, if we talk about the next phase, that is about 4 to 6 weeks post surgery. Now, this is the time when we want the muscles and joints to get active. So active and passive mobility and muscle exercises, both for motion and for strengthening, would be constituted, and we would like to achieve near normal range of motion and with constraints of the pain. Increase the pain, get back to the movement as much as get the patient into an independent mobility mode. Well, now physiotherapy in the second stage would also focus on to train them to get into the habit of daily activity. That is what going to their toilets, stair climbing, moving around the house, and whatever their house demands. So this is the time when the subjective assessment of the patient surrounding and this thing comes into role, and physiotherapist is better equipped to decide and to determine what their patient needs best, because they are able to visit the patient at home and design a protocol for them and even give feedback to the surgeons about the patient's recovery and the outcome. Well, now moving on phase 2 to phase 3, this would be the time when we would want the patient to get rid of the walking aids and support, develop proprioception, develop balance, and develop a steady gait. The focus on stage 3, that would be about 1 to 1.5 months post surgery, would be to develop balance and independence from any walking aid, be able to manage obstacles like stairs or higher lower surfaces, and get into better functional ability. Well, as I already talked, this will mainly focus on developing balance and proprioception and gait training. Well, individualized rehabilitation program that includes strengthening and function of the motion has to be done to develop a good result, and each case has to be individualized as per the surgeon, the physiotherapist, and the requirement of the patient. Well, about 6 to 8 weeks is the time when we expect the patient to get into almost near approach to about to achieve 80 to 90% of whatever we have aimed at the movement and the mobility. And the next phase, which is a long phase, which may constitute and may start from say 2 to 3 months and may continue about to 1 year, is when he builds upon whatever we have gained in aid. And this is the time when a physiotherapist, again, maybe on intermittent basis, provides inputs to the patient and the surgeon to gain whatever is expected out of it and not be satisfied with whatever we have gained, because there is much more to gain in this period. And again, the focus is mainly on strengthening of the muscles, gaining the range of motion, and helping them be able to do various activities of daily living, driving, playing, journal, social listening, all kinds of activities. What a normal man does, we have to help them to get back to that activity. Well, one thing is nearly all our patients may not be of the same caliber, and we have to watch out for certain people. And lot of times these are the physiotherapists who tell us about these special needs of these patients, and we have to assess them pre-op, and we have to be watchful.